His Excellency Senator Doye Diri assumed office as governor of Bayelsa State on February 14, 2020. One of the cardinal objectives of his administration was to improve healthcare delivery at the primary, secondary, and tertiary levels. The decision to do so comes from the importance Governor Diri places on good health.
If a people are not healthy, they cannot prosper. And with our mantra of shared prosperity, we need our people to be healthy.
To find sustainable and holistic solutions to the many problems and challenges the health sector was plagued with at the time, a health summit was organized by the state government in 2021. The summit, which was attended by critical stakeholders in the health sector, produced an innovative health policy and a roadmap aimed at ensuring that Bayelsans have access to safe, effective, and affordable health care in both the urban and rural areas. One innovative approach that emerged from the Health Summit was the application of modern technology to solve the lingering problem of low immunization coverage. For many years, Bayelsa State had low immunization coverage for children in remote and hard-to-reach communities, resulting in high child mortality rates from diseases that are preventable via the administration of vaccines. This primary healthcare problem has, however, been solved. The Prosperity Government, in partnership with Zipline, an American aerial logistics company, is using drones to deliver vaccines, blood, medicine, and materials for medical emergencies to various health facilities in all the local government areas.
The advent of the Prosperity Government, we partnered with Zipline International, the consortium. We are currently now, we are distributing health commodities, immunization commodities, and most medical commodities across the state via drones. And so when the mothers gather in the morning to get vaccines, the health worker will just take the statistics of the vaccines that is needed, and then he will send the signal to the drone nest here in Yenagoa. In 5 minutes, they'll pack whatever commodities that is needed for that facility. And in 54 minutes, the drone will fly that commodity to that facility. And so this will save the time of the mother, the time of the healthcare worker, and also save wastages because you're sending the required amount of vaccine to that facility. So this has significantly improved our health indices across the state.
Zipline has an operational base in Yenagoa, the state capital. With 26 drones in its fleet, between February 22, 2023 and October 11, 2023, Zipline has undertaken 7,194 drone flights and delivered 356,000 vaccines, besides other medical emergency items.
Since we started operating in Bayelsa, we've had over 10,000 life-saving critical medicines delivered to hard-to-reach, far-to-reach region of Bayelsa. And we are currently serving over 200 health facilities within the state. So one of the ways Zipline has contributed immensely to the healthcare strengthening in Bayelsa is access, providing access to medical commodities. Take for instance, a place like Agoro in the Ekeremon local government. It takes about 8 hours to get to that community. This is going by road 4 hours and going by boat another 4 hours. It takes us just 60 minutes to get there and deliver life-saving commodities. Zipline's technology is a new technology. It's a novel technology in the world. The same thing is a novel technology in Nigeria. Bayelsa is one of the 3 states that welcome Zipline technology in its state. It takes boldness. It takes a government that has foresight, a government that sees the future to welcome Zipline in their community. And that is what Bayelsa state government has done.
In the last 3 years, Governor Diri has also improved on the quality of infrastructure for the health sector by building new hospitals, rehabilitating and equipping old health facilities. In Oporoma, Ekeremon, Alebiri and Ogbea, referral hospitals are being built while the Kayama Referral Hospital is already in use. More structures are also being constructed at the Niger Delta University Teaching Hospital, Okolibiri, while a psychiatric hospital has been built in Ogbia Town, the first to be built since the state was created in 1996. Over the last 26 years, proposals to build a psychiatric hospital in Bayelsa State had only been on paper. This facility will advance and expand treatment for mental illness, which is a crucial aspect of healthcare.
For you to have a complete health, you need both the physical health and the mental health. Once the mental health component is not there, you do not have sound mind. Even your physical health is in jeopardy. Now that the current state government, they've established a mental health facility, there is going to be a massive contribution to the economy. You know, one of the first things that this thing will do is it will improve care, access to care. People will no longer need to go very far, as far as Sokoto, Benin, and the rest to go and access care. Now, care is at your doorstep. People can easily access care. The second one is crisis intervention. There are situations where people will have what we call acute episode, where they need immediate intervention to quickly help them. Because this facility is now established, their loved ones can easily be taken to the facilities for that kind of care. The third thing is long-term treatment and rehabilitation. What we have currently at the Federal Medical Center is a makeshift. We cannot do long-term rehabilitation because of the smallness of the place. The ideal thing is that the minimum duration for admission is between 2 to 3 months. Then, as you know, drug is becoming a major problem in our community. They can have the fullness of attention in terms of the full scope of management with the right experts addressing their issue, which means the admission can be from 6 to 9 months, where those things can seriously be addressed, and a lot of our children will be saved from this epidemic that is currently happening all over the world. This facility, mental health hospital established by the state government, is a major scorecard for the current governor, Senator Doidiri, and the current Commissioner for Health for delivering this hospital. It shows that the governor and his team, they have the interest of the people at heart, and it will go a long way in helping the people become more productive and live a healthier life.
At the time COVID-19 was declared a pandemic, few weeks after His Excellency Governor Doyediri assumed office, Bayelsa State did not have a laboratory equipped to test for COVID-19. This constituted a serious problem for managing and treating those infected with the virus. To address this serious challenge, Governor Diri in August 2020 established a molecular laboratory in Yenagoa. The timely establishment of the laboratory, certified by the Nigeria Center for Disease Control (NCDC), made the fight against COVID-19 more effective. Statistics from NCDC show that Bayelsa State till date had one of the lowest COVID infection and associated death rates in the country. In addition, the establishment of the molecular laboratory in Yenagoa also put a permanent stop to testing samples for other contagious diseases outside the state. To address the problem of inadequate manpower in the various government-owned hospitals, Governor Diri has approved the employment of 2,012 workers for primary healthcare facilities across the state to enable them function optimally. Before now, the state's primary healthcare system had only 4 medical doctors as against 100 that have been employed by the Doyediri administration and now work in the primary healthcare facilities in the state. That is a whopping 2,500% increase in the number of doctors at the primary healthcare sector. Also, as a way of incorporating good indigenous medical knowledge and improving on it, Among those employed for the first time into the civil service are traditional birth attendants. In addition, at the Niger Delta University Teaching Hospital in Okolobiri, Governor Diri also employed 250 staff to strengthen its capacity to treat patients and train medical students, while more members of staff have also been employed for the Mother and Child Hospital in Yenagoa. To ensure that Bayelsans receive approved, good quality drugs at any health facility in the state government is successfully running an effective and efficient drug distribution system through the Bayelsa State Supply Chain Transformation Drug Store. At the store, drugs and other health consumables are received from registered pharmaceutical companies across the country and then supplied to health facilities in the state. This ingenious step has drastically reduced the prevalence of fake and adulterated drugs in Bayelsa State.
Now, the aim of this project is to streamline supply chain of drug products in the states. And one main purpose of this is to make available, safe, effective, and also affordable drug products in the Bayelsa State terrain, and as much as we can go beyond. Now, this is aimed at making sure that even our people at the grassroots also get effective drugs that are safe for their conditions and are also affordable. Now, this project is being put together by the Prosperity team and then the consortium. So with this project, we are very sure that as the project grows and as it progresses, the people of Bayelsa State will be free, and it will be easy for them to access drugs and be confident that whatever drug products they are getting from the market system, from the health facilities, are safe products first, and then they are also affordable. And then the effectiveness of those products is well assured. We are looking at quality assurance, standard procedures, and then the procurement of these products are not gotten from an open market. It is gotten directly from accredited marketers, pharmaceutical manufacturing companies, to ensure that what we get is standard for our people. Now, this system does not just work alone. It has a way, it's the inbuilt such a way that the zip line, this also helps to fly drones, using drones to fly medicinal products and vaccines to the various healthcare facilities, the hard to reach area, which we all know that the Bayelsa terrain is a very beautiful terrain, and so that makes drug delivery easy is also a part of this project.
Another milestone attained by Governor Diri is the expansion of the Bayelsa State Health Insurance Scheme, BHIS, started by the previous administration of Senator Seriake Dixon. The scheme, backed by the Bayelsa Health Insurance Scheme Law 2019, is a social intervention program aimed at providing universal health coverage for Bayelsans and other residents in the state.
From every nook and corner of the state, health officers will be coming your way. In the riverine areas and on land, health workers will be coming your way. And all of what they will do has been paid for by your government. So nobody is coming to charge you for all the treatments, for all the medicine that you will receive, and all the surgeries that they will conduct.
Before Governor Diri came into office, beneficiaries of the scheme were only public servants who work in the formal sector. However, that is no longer the case. In tandem with the governor's burning desire to ensure that more Bayelsans have access to universal health care, an aggressive expansion of the scheme commenced under a program called Diri Care. The scheme now has beneficiaries from 4 sectors, namely the formal, informal, the vulnerable, and students.
The whole world is talking about universal health coverage, where every human being should be covered, should have access to healthcare services that are affordable, accessible, and to essential medicines and vaccines. So Bayelsa Health Insurance Scheme is also pursuing that. so that every human being in Bayelsa State is covered health-wise. And that is our mandate. So far, we've registered about 121,600 something enrollees into the program from the formal sector, that is the civil servants and their dependents. The informal sector program started from 2019. The operations were slow, but this year, because of delay care, that the governor has asked us to make moves to increase enrollment from the informal sector into the scheme. We have signed a memorandum of understanding with the Muslim community to come in. We have signed memorandum of understanding with the tricycle operators in Bayelsa State to come in, all of them, through their executives. We have signed memorandum of understanding with private school owners to come in. So as the weeks go by, we'll be moving from one group to the other to register them into the program.
Between February 2020 and September 2023, an additional 36,000 people have registered with the scheme, bringing the total number of enrollees to over 150,000. As at December 2022, 107 health facilities have registered with the scheme, with 70 hospitals providing primary services.
Every week, each group goes out to see all the hospitals, those that are under the scheme. Of course, we are only interested in the hospitals that are registered under the BHIS insurance. So most of the times in a week, we visit up to 13 hospitals, 14 hospitals and 15 hospitals. And as we visit, we make sure that we see all the enrollees that are admitted in each hospital.
In the last 3 years and 7 months, these facilities have successfully carried out 6,293 surgeries, including 1,488 cesarean sections.
During that period, when she delivered, there were some challenges, serious challenges. But at the end of the day, they came out strong and healthy. Financially, I wouldn't have been able to pay all those bills from my pockets. But with BHIS, I thank God they cleared the bill. So I want to appreciate the governor of this state, Senator Doye Diri, our governor, our amiable governor, for this program. Is helping a lot.
I've been one of the beneficiaries for government for BHIS. The government tried for me. If not me to go hospital to go pay this thing for now, things there, no way. Since July 25, I fall, break my lap. Since then, the government, they take care of me. I thank the government.
During my last baby delivery, during antenatal, the doctor told us that the baby's weight was too much for normal delivery, so we had to go through CS. And thank God, I'm under the BHIS scheme. I paid nothing. Myself and my husband, we didn't pay anything. My first delivery was twin set. That was 2018. It was through CS2. We are still under BHIS scheme. We paid nothing.
The Bayelsa Health Insurance Scheme is today adjudged the best in the entire country, and for good reason. The scheme every month currently pays capitations and premiums amounting to 100 million naira directly to healthcare providers, resulting in quick and effective services for beneficiaries, as well as upgrades in facilities and manpower for the hospitals.
As at December 2022, we have paid over 4 billion directly to the hospitals. We pay in 2 ways. One is called capitation. Capitation means that for everybody that is registered into the hospital, we pay a certain amount of money on behalf of the person. So that out of the lot that are registered in the hospital, if a few is sick, they have that money to take care of that few. Beyond that, we now pay for fee-for-service, the one we call fee-for-service, where beyond primary level, secondary activities are taking place. Secondary care is given. Then we pay for every drug, we pay for every needle used, we pay for every cotton wool used, every glove used. We pay for the bed fees, and then we also pay for surgeries and all of that. So that is for the secondary care and tertiary care, which we call fee-for-service.
Now at the HMO level, they accumulate all the funds somewhere, and then they suppose trade with those funds, and then they don't pay the various capitations and then the premium to the healthcare providers. But in the Bayelsa State system here, that is not happening. You deal directly to the health facilities, the healthcare providers, and the patient directly. And so no money is kept in HMO anywhere that they will fix those money to be doing business. When you require it, you don't have it. And so here it's quite different. And so even the National Health Insurance Scheme, National Health Insurance Authority, when we hold our meetings, they want to adopt our model. And that is the model that is best anywhere you go to across the Federation. Other states are trying to adopt what we are doing here. We may not be perfect, but we are heading somewhere.
Governor Diri went a step further to enhance the operations of BHIS by building a new complex to replace the old office, which was not conducive.
Today we are reaping from the benefits of continuity in governance. This health scheme was initiated by my immediate predecessor, Alias Ofroma Pepe. And when on board, we looked at it and we saw the benefits, the enormous benefits to our people. And we decided to continue with it, not only to continue with it, but expand it. And today, it has been expanded beyond the formal sector. It has included the informal sector in our state. And we also felt that as robust as the scheme has become, we needed a befitting office space. And we initiated the construction of the Health Insurance House. It is completed, and today it will be inaugurated.
The BHIS office complex has well-equipped staff offices, a library, lounge, boardroom, creche, ICT server room, conference hall, and a lecture theater. The speedy completion of the health insurance edifice within 7 months at the cost of 800 million naira underscores the prime place Governor Doye Diri places on achieving qualitative universal health coverage for Bayelsans.
Today we are very happy that a lot of our persons in their number has turned up to register for the health insurance scheme. We know the health insurance scheme, we're going to go extra mile to help our persons, our people in various aspects of it. The cost of living is very high, but with this health insurance scheme, even if we don't have the physical cash to pay for admission fee in the hospital, with the health insurance so far, we have also involved ourselves. We can go to the hospital and access free health treatments.
The expansion of BHIS has no doubt impacted positively on the health-seeking behavior of Bayelsans. Rather than self-medication or patronizing quacks due to lack of funds, more Bayelsans now go to hospitals when sick. Over the last 43 months, the Prosperity government has spent over 24 billion naira to improve and expand healthcare in the state. The dividends of these investments and other innovative measures being implemented in the health sector are evident. As His Excellency Governor Doye Diri actualizes his goal of making his people wealthy by ensuring they are healthy, he is without doubt leading his people on the path to prosperity.